and he will be speaking on Amendment 2 that is on the ballot. Ed?
Yeah, thank you. Let me just get my screen going here. Here we go. Okay, well, thanks for inviting me. We'll just spend a few minutes on this, but I think it'll be a few very important minutes. The idea of people not having health care in a country like ours is baffling to me, especially when, as you'll see in the next few minutes, that we can fix some of that problem here in Missouri for folks while actually saving money for the state. We can actually have a net favorable impact on the state's budget. So I want to walk you through that at a very high level. You may already be familiar with some of that. If you are, then pay attention perhaps to the words that I'm choosing, because they're selected to be hopefully more effective. Hopefully over the next week before the vote is cast, you'll have a chance to influence either yourself by this or to influence some of your friends and such. So we'll go through some of the information, and then at the end we'll talk a little bit about what you can do as next steps if you are, as I hope, motivated to get more involved. It's a lot of people. The people we're talking about providing insurance for through Amendment 2 are almost entirely working today, but they're working in jobs that don't pay them enough money to qualify for a subsidy through the Affordable Care Act, but yet pay them too much money to qualify for Medicaid in Missouri. So they're in this gap. They're typically working at these jobs you see here. You might be, some of the people watching this webinar may be working in these jobs, and certainly we were all having contact all the time with folks in these jobs, and yet they don't have insurance. They don't have access to insurance in any particular way. So the first thing to understand is that Amendment 2 will actually protect our health and our lives. Hundreds of thousands of Missourians, at least 230,000 more Missourians than we have today will have insurance if we pass this bill. That doesn't get us all the way to complete coverage, but it gets us much further. Insurance, as you know, doesn't actually mean that you have health care, but it sure does help. It's a big step forward. Another crisis plaguing our state, and we're one of the epicenters in the country for this, is that our hospitals have been closing. We've lost 7 in the rural communities since 2014. That's in part because the Affordable Care Act intentionally reduced what they paid hospitals to take care of uninsured people with hospitals' agreement, because with Medicaid expansion, that was an okay thing to do. Since we didn't expand Medicaid, many of our hospitals have been struggling and closing. There's a few other reasons why hospitals are closing, but one of the biggest ones that we can fix with Amendment 2 is reducing the number of uninsured people that the hospitals try to take care of and yet aren't able to. So Amendment 2 will preserve our particularly rural hospitals. And as you can imagine, people that have insurance, as Amendment 2 would accomplish, would be more likely to get treated. We've got proof. These folks get treated for their diabetes, to get earlier and more successful treatment for cancer. It saves lives, and essentially hundreds, at least 250 and maybe twice that of Missourians who die every year under today's circumstances would not die the year after we expanded Medicaid. So we can save hundreds of lives and do that while actually helping the economy of the state. So it's not a decision or a trade-off. It's actually we get to do both. We save the state money in 2 particular ways. First, we can actually stop having to pay as much for some of the things that we're paying for, because Amendment 2 means that today the federal government reimburses us for about for 65% of our cost for taking care of Medicaid patients, whereas under the expansion population, it goes up to 90%. So some of the things that we're paying for today, either at the higher cost share or entirely, become much better funded through the federal program. In particular, if you can think of it, people who get pregnant next year are not in Medicaid today, but they would be then. And then that makes them suddenly eligible for the 90% federal funding instead of the 65%. So there's many other categories like this, but this means that we get better reimbursement for Medicaid across the line. And that adds up to $60 million less that we have to spend that we're spending today. And then we bring in roughly $58 million more in new revenue, because if you think of it, Medicaid expansion means more work. There's things we have to do that we're not able to do today. And that's roughly 16,000 or more new jobs, new good, well-paying jobs within our state. And more people working means, of course, more state revenue from income taxes and sales taxes. So we can increase the revenue to the state by $58 million without having to raise taxes, which is a pretty phenomenal opportunity. If you add that together, the net impact is nearly $120 million in a single year. I think that number is for the year 2024. So we can help our budget by $120 million per year if we do this. And that's real money. That's enough money to make a real difference on what our schools can afford to do and all sorts of other services that we're limited at today. And then, of course, we're currently paying the taxes to do this. You know, when the ACA was passed, our current tax model pays for Missouri to have Medicaid expansion. So we're paying those taxes when we pay our federal taxes, and yet we're not getting the thing that was designed for. The taxes are levied to ensure that we have the expanded Medicaid population, and yet we're just not smart enough, I guess, to accept the program. So it turns out that the pandemic has been making this, if anything, even more important. It's shown us that it doesn't matter if you're black, white, brown, if you're whatever your background is, we all need our health care. And failing to accomplish that hurts us individually, hurts our communities. It's part of the problem with our schools and our entire state. And we need this now more than ever. The predictions are that we're going to have, of course, we're not out of the woods at all. We're not even near the edge of the forest with COVID. And so the predictions are that over the next several months or a year, there will be 200,000 more Missourians who will lose their job and therefore lose their access to insurance, who would be covered under Medicaid expansion, but would not be covered under today's model. So there's perhaps hundreds of thousands more people that this would benefit. And really, we're all in this together, as we know. You know, our health has a big impact on our ability to work and therefore on our economy. And as we're learning, thanks to COVID, our economy and our jobs have a big impact on our health. So the two larger newspapers in St. Louis have been pretty clear about this. The St. Louis American said voting yes on Amendment 2 for Medicaid expansion may be the single most important reason to go to the polls on August 4th. Although I'll let our next two speakers persuade us that the other issue is also important. And the St. Louis Post-Dispatch made a comparable statement, only maybe a little bit more, I don't know. They said, tell that cabal, by voting yes on Amendment 2, you can tell that cabal of ideological extremists in Jefferson City that this state is at last ready to join the 21st century. That's literally what it is. So if you want to learn more, go to the Missouri Foundation for Health. If you can remember that name, if you're not already familiar, mffh.org, or just remember the phrase makes sense MO. If you can Google makes sense MO, you'll find tremendous resources with more background and simple and complex information. And if you want to get more involved, go to yesonto.org, and that's where you can go to get yard signs. It's not too late to do that, to volunteer for phone banking and other things, and of course, to donate. So, thanks.